Hello everyone, my name is Bria Hamlet and I am an MPH candidate at the University of New England and the online MPH program. And today I'm going to share with you my community health assessment for San Diego County, located in San Diego, California. So just a little background on the demography of San Diego County. It's almost evenly split, male and female, and as far as its racial and ethnic breakdown, it's primarily non-Hispanic white, followed by Hispanic, followed by Asian, although all racial groups are represented within San Diego County. An interesting sentiment about San Diego County is that a very large portion of their residents are actually between the ages of 18 to 64 years old, as approximately 64.8% as of 2017 belong to that age bracket, followed by a small portion of persons under the age of 18 and a small group of persons over the age of 65 as well. And for the purpose of my community assessment, I decided to follow the precede-proceed model, or otherwise known as the PPM. If I were to have conducted this community assessment on a much larger scale, I would have been able to go a bit more into depth about these steps, but what I suspected would be a good way to approach analyzing San Diego County is starting with the social assessment, so doing interviews of residents, whether they be students or retirees or homeless persons even, to get an idea of what the social perspective of San Diego County is, followed by an epidemiological assessment, so that would include reviewing health surveillance data, and kind of seeing what health incidences, what diseases are most prevalent in the county. That would be followed by an environmental assessment, which could be a windshield survey, so me personally driving around the county and observing different things that are associated with different health outcomes. And then from there, we could go and do an educational and ecological assessment, so maybe handing out surveys and asking persons in the community how much they know about certain health issues or health resources in the community. That could be followed by a policy assessment, so looking at maybe barriers to care or laws in place that either facilitate or prevent certain health behaviors. And from there, we could design an intervention and then implement it. And following that, for the evaluation portion of this model, the process could be evaluated by outside evaluators to avoid bias, and then the impact that could look like surveys that were given to community members after a certain health intervention once they participated in it. And then the outcome evaluation would be done probably by outside evaluators as well as internal evaluators to make sure that the efforts truly captured and impacted the community at hand. So following that, some more information just about San Diego County. As I mentioned before, it's composed of a high proportion of persons who are between the ages of 18 to 34. I'm sorry, 18 to 65, but a good chunk of those people are 18 to 34 years old. And that is primarily because there are quite a few large universities and colleges in San Diego County. And so there's a huge proportion of people that are coming from overseas and across the country to pursue their higher education. And globally, on a global scale, the most common health issues for this health bracket, and for this age bracket, include teen pregnancy, STDs, or sexually transmitted diseases or infections, including the human immunodeficiency virus, mental health concerns, drug, alcohol, and tobacco use, and obesity. So I was interested in assessing how those issues that are globally big problems for this age bracket stacked up within this county. And so just looking at some of the health determinants for San Diego County, I was able to assess that overall, San Diego County is kind of leading the improvement of health determinants in the state of California. They have a higher high school graduation rate, a lower unemployment rate. Their income inequality is about average with California, which, as many of you know, is one of the most expensive states in the country to live in. So that is not terribly surprising. And their uninsured population, while is on par with the average of the rest of the state, is still fairly low overall in comparison to other states. And so here are the health outcomes that I assessed for San Diego County in comparison to both the neighboring county of Orange County, the rest of California, and then the United States as a whole. And as it turns out, for the most part, again, San Diego is so sort of leading in lower premature deaths, much lower adult obesity, which probably can be attributed to the healthy lifestyle that is really encouraged in San Diego, as well as lower rates of adult smoking and physical inactivity. However, there are still very high numbers when it comes to teen births and STIs. Particularly STIs, it's nearly double the national average. So there's clearly a gap there in either services or care, seeking of care perhaps. And so I dove a little further into each of these health issues that were brought to my attention from the previous assessment, and on average, these are the ones where San Diego was doing the best. As far as adult obesity being lower than the national average, and then some opportunities to grow. So resource inadequacy, I was able to detect that there are still some gaps. So physical inactivity could be improved by improving access to physical activities that are pretty strenuous or require one to be able-bodied. So for example, there's a lot of extreme sporting in San Diego, so surfing and biking and rollerblading and things that maybe the average person or a disabled-bodied person might not be able to participate in. So making those sports available, or making sure that persons who can't afford the equipment associated with said sports have access. But overall, this county is still leading in these issues and actively decreasing their percentages each year. However, the critical health issues that I identified, as I mentioned before, that were not improving and in fact were getting worse for San Diego County include teen births and sexually transmitted infections. Chlamydia in particular is the most commonly reported communicable disease in San Diego County. And while there are 4 county clinics that are available, and there are clinics available on the campuses of each of the major universities, there seems to be a lag between what's available and who's seeking out resources. And there's also the gap of persons who maybe don't speak English as a first language, or otherwise don't have health care, or are concerned about privacy, not pursuing these resources. And here's just a bit more in depth about the sexually transmitted infections in San Diego County, what that picture sort of looks like. It's also important to note that the people who are more frequently being diagnosed with chlamydia in particular are young women ages 20 to 24. And with women, it's interesting because there is that annual sort of nudge to receive care for most women who are either on insurance or have some sort of healthcare plan to see their GYNs annually, their gynecologists annually, and so that they might be receiving those testing more than their male counterparts. So that might be something to take into consideration with their diagnoses being much higher than their male counterparts who might not be seeing a doctor on a routine basis. And of course, risk factors for STIs in STC, but honestly in any locale, include engaging in any sexual activities without any methods of barriers, participating in any other unsafe sexual activities, sustaining multiple sexual partners, particularly at once, declining to seek routine STI testing, and of course low condom efficacy, so low initiation of barrier methods or even safer sex conversations, so asking partners about their status or the last time that they received any STI testing. Some potential interventions for STIs and STC could include an expanded roster of free and affordable clinics and testing in low resource areas. So maybe areas that are not near the campuses, that don't have a health center dedicated to the community, could be receiving more mobile testing units or rapid tests or health fairs, so that persons don't feel like they're being singled out if they go to visit said mobile testing unit, but instead just using all of the resources at a health fair. And then, of course, widely sharing information about routine STI screening and testing, as well as treatment options. So kind of taking the mystery out of pursuing medical care for STIs, and also taking the fear out of it. And then, of course, increasing access to barrier methods. So encouraging people to engage in safer sex simply by giving them the resources to do so, whether those be dental dams for oral sex, condoms for penetrative sex, or finger cots for digital or manual sex. And so thank you for listening to this presentation, and here are the resources I referenced throughout this presentation for any follow-up on the data I presented. Thank you.